And does anybody have any questions they'd like to get out of the way right now before we get started? Not. Okay. Well, all right. So I guess first thing we should go over real quick is Egoscue. That's how you pronounce it, Egoscue. We get that question a lot, and it comes from our founder's name, Pete Egoscue. And many of you have read the book, so you know that, but that's where the name comes from. He created this method kind of out of necessity for himself in the 70s after he got back from Vietnam, injured as a Marine. And nobody could really help him anymore. So he kind of turned to the anatomy books and kind of through some self-discovery, figured out how his body was out of balance, out of alignment. And when he corrected that, he felt better, you know? And so it started from that, and he started helping other people, and just kind of through trial and error and learning, he now we have this method that's worldwide. We've got 30 clinics, about 30 clinics around the US, and a couple in Mexico, a couple in Japan, and other people like with the books everywhere in between. So, but we're going to be talking about hip pain specifically today. But I think one of the things that sets us apart at Egoscue from most of the Western medicine world is how we view pain in general. And that is that it's really a signal. It's our body's way of talking to us or communicating with us, one of the ways it does. And so rather than thinking of pain as a sign of damage, think of it as a warning, or like a check engine light on your car. It's trying to tell you, okay, something's maybe not working the way it should, or you need to look into this. Your car may seem like it's running fine, you know, like everything, there may not actually be anything broken yet, but there could be if you ignore it long enough. So in treating pain, we have to remember we're not just treating the symptom, the pain. That'd be like just turning off that check engine light or covering it up so we can't see it. We want to actually treat the reason that light turned on in the first place, right? So that's what we're all talking about today. So the cause of our pain, these are just the most common things people blame their pain on. You know, age, oh, I'm just getting old, which I love to talk about this in regards to the hips, because, you know, if any of you have had hip x-rays or arthritis in your hip, that's a pretty common symptom that we deal with and mostly attributed to age, but almost always one side is worse than the other. Or one side hurts more than the other. So then you have to ask the question, well, if they're both the same age, why does my right hurt more than my left, or, you know, vice versa? So age, you know, plays a factor. It's the older you get, the more wear and tear you're going to have in general. But if your body's in balance and doing everything like it's supposed to, then there's no reason that you know, our joints shouldn't last our whole life. Barring, you know, traumatic injuries or things like that. So genetics, same thing. You know, there's not that we found at least, you know, like hip pain gene or even arthritis gene for osteoarthritis, at least. Our jobs, kind of like with the racquetball, I think of our jobs are, you know, if we hurt when we're sitting, for example, at a computer, is it really the computer's fault, or is it, you know, could our bodies be in a better position maybe to be able to sit longer periods of time without hurting, you know, to put up with that stress. So at Egoscue, of course, the big word is posture, and really we're talking about the whole body. And so just like this house, obviously it's not very stable, it's not in alignment, it's not straight anymore, its foundation is maybe crooked, so it's causing it to just about fall apart. And so maybe some of your bodies feel like this at some times, like everything's falling apart. But obviously, I think we all intuitively know that alignment is important. A lot of times we think about posture, or we hear the word posture, and we only think about, you know, our backs or pulling our heads back or shoulders back, you know, but it's really more involved than that. We look at the whole body, all the parts. We focus on the main load-bearing joints primarily, but really each joint has its position, its design, its purpose, and when it's not in the proper position, it causes extra stress. Really, could affect anywhere in your body. And so when it's in good posture, proper alignment, it's all about balance, equal weight distribution, it's more stable, it's going to protect against injury. And it's also, we talk about standing posture just because that's easy to capture and measure, but, it also applies to how you move. So standing, sitting, squatting, all that stuff, there's a proper posture. So our bodies are designed to move, and really, I think if you could summarize most people's modern day pain into one thing, it's due to lack of movement, or lack of good movement at least. And so as we get older, we tend to not move as much. We're not playing like we used to. We may exercise occasionally or even regularly, but we tend to do the same exercises over and over again, or the same sport over and over again, and we're just not getting enough variety. We sit so many hours a day, either at work or in our cars or on our couch or on our phones now. It's just everything on a modern lifestyle promotes us to not move. And so that's why we have to substitute or supplement with exercises. It's getting everything, all those muscles that are underutilized and joints that are not moving properly to do what they're supposed to again. So ultimately, if we want to treat your pain, whether it's your hip pain or anywhere, we have to, once again, go to the cause, ask the question why, not just what, because the drugs, the surgeries, they can definitely help reduce symptoms. And if there is some significant damage that needs to be repaired, that can be very helpful. But ultimately, we need to make sure we're addressing that big picture cause, what led to that, so it doesn't happen again, right? You can't just rest for forever. If it feels good to just not move, that's going to have consequences too, ultimately. So we want to get you back to being active without pain or without relying on drugs or surgeries if we can. So, all right. So any questions so far? We had any questions in the chat? Kelly can take care of those if so. Okay. So hip pain, we're not going to go into a ton of detail here. I'm not going to test you on all these names, but I think it's important to see kind of what we're talking about. We talk about the hip, and there's a lot of different parts of the hip. And so the hip, you guys can see my cursor, right? Mouse, you should be able to. So this is looking at the front, your pelvis, your spine is starting here and going up. So on either side, obviously we've got hip joints. So it's really a ball and socket joint. So you can see that your femur or your upper thigh bone here, kind of like my fist here, goes into the acetabulum there, and it creates that kind of ball and socket. So it can rotate really quite a lot. It has quite a bit of range of motion, ideally. And we also have pelvis and some other joints like your SI joints. You may have heard of sacroiliac, that's up here, connecting the pelvis to the sacrum, which is connected to the spine. So anyway, we're focusing mostly on these joints here. And you can see from the side view too, just a different angle. So if you can start to think of this in the bigger picture of your entire body, and think like, as we talk about, and maybe show you some exercises later about that may address different parts of your body, and think about how it's all connected. So right now you can see how the pelvis is level. There's two equal sides. They're pretty much mirror images, right? Well, what happens if one of our legs points out and one points straight? Or maybe your pelvis is a little bit higher on one side. Maybe you're slightly twisted, one shoulder tends to sit more forward than the other. So how does that affect your hips, right? Well, since, you can just imagine moving that pelvis around, and think about then that changes the position of that femur head in the socket, right? So now it's not sitting where it's supposed to. And every time you take a step or you move or use your hips, they're in a different position, and it's going to put that stress in a different part of the hip socket. So typically, so just some common hip symptoms, talking specifically about arthritis or degenerative hip, that's basically just excess wear in the joint, inflammation develops, the cartilage starts to wear out, you start to lose, there's space in there and fluid to help create nice movement. But when that starts to get worn away, then you start losing the ability to move your hip through a full range of motion. It gets difficult to do things like putting on your socks or sitting cross-legged, things like that. So the way I think about a degenerative hip is it's really just a loss of proper position and function of that ball and socket, meaning it's not right angle, or maybe you're really stiff and it's only moving through a partial range of motion. And so it kind of just like grinding in one spot in that joint instead of moving, throughout the whole socket and distributing that stress evenly, you end up wearing out little bits and pockets of the cartilage. So once again, it all comes back to getting pelvis, your hip joints, all the joints above and below it moving properly so that we don't put that extra stress there. So SI joint, we talked about the SI joint is here. So that's typically felt more like in the very low back and just on either side of the spine, maybe on one side more than the other. Labrum, tears, that's part of the connective tissue that kind of holds the ball or the femur head in the socket. So that can tear. Bursitis is another common one. The bursas are just fluid-filled sacs that kind of surround joints typically, and they can get inflamed or swell and become irritated due to extra friction. So these are all things that, by the way, can be addressed through posture. We see all these symptoms on a regular basis, and they can all be helped with this type of therapy. So I know we get a lot of questions about, well, what if I've been told I need a hip replacement or I'm bone on bone? That's a pretty standard question we get. And maybe I've been talking a lot. So Kelly, do you want to, what's your opinion on degenerative hips? Or if people ask like, oh, can I avoid a surgery? Or are we pro-surgery? Are we anti-surgery? What's your take on that?
Yeah. Well, how many people on the screen have a hip replacement or been told they need a hip replacement? Raise your hand in the reactions. If you go to the bottom and you can raise your hand on the actual screen, it'll have a little like emoji hand. So a few, yeah. Well, yeah, and like who wants to have that diagnosis, right? Like there's a lot of people who are like, oh, wow, that's so scary, or I don't want a hip replacement, or I want to try everything possible to avoid a hip replacement. Well, your intuition and your gut are exactly right. I always love the analogy of, if you're driving a car and the alignment is off on the car and you keep driving it and wearing down the tires, but you just keep replacing the tires and you never actually reset the alignment of the car, you're just going to be replacing tires for the longevity of that car, right? So your body's the same way. It's a vehicle and your joints are the tires. And so when your body's out of alignment and you're just, doing the surgeries, taking the pills, doing all the short-term solutions, the long-term solution is missed, which is realigning the alignment of that car or that body. So it doesn't matter whether you had hip surgery or hip replacement, or they've told you you need one. Either way, push comes to shove, you still have to get your alignment in check, in order, in place. And my philosophy is always, hey, let's get your posture in alignment the best that we can prior to your surgery if you've already chosen to have a surgery. That way you go into the surgery and come out with optimal outcome. You're still going to have to do the Egoscue work after anyway, because all of the misalignments and muscle compensations that you would go into surgery with, you come out with as well. They just take out the part and put in a new one. They don't actually get rid of all of the reasons why it's there to begin with. And usually there are many if you're at the point where it's fully degenerative and you need a full replacement. So that's my 2 cents on kind of where we stand from the functional standpoint of Egoscue and, hip pains and surgeries.
Yeah. Yeah, I think, yeah, I agree. I think in general, obviously, most people, I think, want to avoid the surgery. It's pretty invasive, and there's big recovery and risks involved, but it can be helpful. I mean, I've worked with plenty of clients who've had the surgery and are grateful they did. But they also did their Egoscue before and after to ensure that they were addressing those issues, so that when they got the new hip, they their alignment was better, so they didn't have to worry about wearing it out or wearing out the other one or their knees, and so
yeah, it's very common to have multiple surgeries if you don't realign the body. If you've had one surgery, you're more susceptible for a second and a third. Whether it's the opposite hip, the opposite knee, it's very common.
Yeah.
Without fixing the alignment.
Yeah. Does anybody have any questions about any of that, or maybe any symptoms that aren't on this list? Anything we're missing that you're curious about? If you don't want to share it publicly, that's fine. You can talk.
I would like to just give a testimony. Can you hear me?
Yeah. Who's talking?
Okay, I'm in Canada and on the Sunshine Coast. I had my hip replaced in 2018, and it was definitely an arthritic problem. And I danced professionally for 30 years. Okay, so you might think, oh, wear and tear. But it was really, no, it was more like I had good alignment, pretty good. I got the book. I found it really incredible for pulling things into alignment, because I could really feel I had stopped for about 15 years when I got my hips. Well, the book helped me so much, but from the get-go, the whole issue kept asking me, pain, what's your pain? I didn't have pain.
Yeah.
The only thing they understood was pain. It was dysfunction. Things just weren't working. And I was, relying on, and things have gone since then. But the hip replacement was very successful. I'm working with neurological issues now from stenosis.
Mm-hmm.
So this could go back and back, but I just wanted to endorse that I asked them in my surgery, I said, could I have a look at the bone that you just took out of my body? And sure enough, it looked just like a piece of barnacle. And there's no way that any kind of posture is going to take that away. And I wasn't feeling any pain. I could have gone on and that would have just ground away. I was just kind of falling down like that house, but I didn't feel pain unless I fell down and scraped my elbows. That's all I have to say. Thank you.
Wow, that's amazing. Thank you for sharing, Janet. I think you made a really good point that, brings it all together, is that your hip is connected to your spine, just like in that picture that Zach showed this one slide before. If you take it back one, Zach, that even though you wore out your hip joint dancing or doing whatever, your posture, your hips are the same age. And if one is out of alignment, then there has to be some sort of a muscular imbalance pulling the bones into a different position to be wearing and tearing on one side of the body versus both sides of the body. And then what happens is, because all those bones and muscles, ligaments, and tendons are attached to the sacrum and the spine, it's very rare that I meet someone with a degenerative hip that does not also have lumbar spine stenosis or narrowing of those vertebrae or herniations, etc., because it's all connected. And so you're absolutely right. It's a good thing that you found Egoscue and you're continuing to do the work, because like I said, most people, they have one thing happening with lots of other compensating things as a result, and they all go together hand in hand because we're all connected. And you want to be addressing your posture every day with
exercise.
That's
what I wanted to say. It's never over. It's only the beginning.
That's right. That's right.
You have to kind of keep, and it might not always be Egoscue. It might be, you might do Pilates, you might try this, but you keep exploring and you keep just connecting, listening to what your body's telling you and just following what it wants to do.
That's right. That's a huge thing in Egoscue that we teach, is really how to listen to your body. That's our number one, thing that we teach is helping people to be more kinesthetically aware and present in their bodies so that they can use the exercises. I had such a great session today with a client. She said she had gone on vacation and she didn't do her exercises. And while she was gone because of the setup there. And then when she came back, she noticed she was sitting in all of her old posture habits that created the sciatic pain in her pelvis and hip that she had prior to working with me. And so because she stepped away from her exercises for a good 2 weeks, when she came back, she had gone right back into her old habits again. And then she had to get back into her exercises to get back in touch with her body, to get back into alignment again in her daily life and her activities, and everything shifted at home. So it's such a testimonial to like being consistent with your exercises so that you can stay in tune with your body, know what it's trying to tell you, and then adjust as needed with your tools. Toolkits are huge, and Egoscue's number one on my list for my toolkits for how I treat my body and keep my body optimal.
Kelly, I'd like to join in here too with a testimonial. I've been working with Martin.
Yeah, my husband. Mm-hmm.
Yeah, since last summer. And I first went to Egoscue for a second time, actually. I've been in 2013 in Los Angeles.
Nice.
I went because I was diagnosed as needing hip surgery. And I thought, I'm going to do Egoscue instead. So I started, and my posture was goofy. And after about 3 or 4 weeks, we did another posture picture. It was a lot better, but the hips needed the surgery. There was just no getting around it. So I had one done in November, one done in December. And it's been absolutely amazing because I believe I also do yoga every day. I believe the yoga and the Egoscue, starting for months ahead of the surgery, made a huge difference. I had literally zero pain with the surgery, didn't have to take the drugs. And then I'm continuing now with Egoscue, and we're starting with Martin again. So I'm doing physical therapy, yoga, and I'm doing all the Egoscue postures he gave me in the summer pre-surgery. So now we're going to look at how I am now and what I need going forward in this new configuration of my
and your new body and your new hips.
Yeah.
I love it. I love it.
So it's amazing. It's amazing. And don't worry about hip surgery.
A lot of people are worried about that. And we
Don't
deal
worry.
with that a lot. That's a huge question that looms over people's heads is, should I have surgery? Should I not? And we never make that decision for people. That's not our job. We're not healthcare practitioners. So our job is really just to help identify the posture that's going on that created the imbalances and the degeneration in the first place, and work with the body, but also we help bring peace of mind when you can understand your body from a biomechanical standpoint, from a posture perspective, and you understand what's going on. We teach you, we get out the anatomy books, like the ones that's, pictures that are right in front of you. We teach you about your body. So it gives you this peace of mind and this sense of like knowing yourself. And then once you have that trust and then knowing, it's so much easier to make decisions from that place versus a place of fear. So it's definitely something that we work with clients, on a regular basis. So, and I've never had any client have surgery and have bad results in 20 years. Right. Knock on wood. I haven't had anybody come back with flying colors within weeks and months, or never come back again because they've got their tools, they had their surgery, and they are off and running, and they're emailing me 5-10 years down the road. I'm doing great. Just wanted to say hi, or they stop in my office. It's awesome. So surgery is not the enemy. It's just something that people have to really work through internally, personally.
The only thing I would recommend is that you interview numerous surgeons and you go with the very, very, very best. The newer techniques, my surgeon cut no muscles, zero muscles.
Wow.
So
that's good information.
Yeah. So go with anterior, or don't do the posterior. Go with the new methodology. It's incredible.
Yeah, I always encourage my clients, no matter what it is, to be knowledgeable about whatever it is that you're doing for your body. Even Egoscue, come in, have a consultation, do the workshops, get to know us, get to know what the method's all about, make sure it's the right fit for you, right? We want you here because you're totally in alignment with who we are, what we do. You know, we talk our talk, walk our walk, and it's a lifestyle change. Egoscue is something you do from now until forever. It's not a quick fix, it's a long-term solution, and you're gonna feel different and better from the first time you do it. So to keep you out of having surgery, let's keep going so that we can learn about our bodies and
we had a few
doing some exercises.
Kelly, we had a few hands raised. I just wanted to make sure if I didn't know if
Okay.
those were old or is it Terry, Stacy, and Sonia, or those from earlier? Did anybody have?
Nope. Mine's current. I have a question.
Okay.
So I love everything that I've been learning, and I know that I have the pelvic torsion, and I've got the twisted shoulders, forward shoulder, and then I've got the higher hip or on one side. I've got a lot of things. But as I'm doing,
how many of us do? Give her some love here. How many of us have lots of things going on? Yeah.
As I'm doing this stuff, my left femur really hurts. So like when I do the progressive supine, I've started, I haven't quit doing it, but I do my left side after I do the one on the back. I do the left side first, because if I do the right side first, the left side hurts quite a bit, and then it shoots pain all the way across my pelvic bone to my center line.
Okay.
And then so like if I do the frog and anything trying to get that mobility in that joint is painful. And then when I do the 2-footed tower, I usually just do the first 2 top ones for a while, because when I used to do the whole thing, I kind of felt like, when you try to change a baby and you're holding their feet and their whole body spins.
Yeah. I
feel like that's what happens after that. I feel like my whole torso and everything just got shooken out of shape. And so well, my question is that pain in that joint is so intense that I was just like, what am I, is it just more time, or am I missing something, or?
Yeah, there might be. Are you working specifically with someone, Stacy?
Not yet.
Not yet. Okay. It sounds like there might be some modifications or variations to different exercises that you might need that you're not getting directly. I mean, we have over 500 exercises in the method. So there's so many modifications and variations depending on the body that we're working with. So I always tell people, if you're using the book and you're using the YouTube videos and you're not getting the results that you want, you better call me right now, because there's so many other ways to get the results you're looking for. It's just, you're limited with what's in the book and what's on YouTube. So yeah, I would encourage you to reach out and talk to Zachary one-on-one for sure. Because you're not the first one, you're not the only one. That's definitely something we've experienced before.
Yeah. My hips, well, one of the things my hips used to not even be able to, if my hips were straight to the counter, my shoulders were like that.
Yeah.
So I've made a lot of progress. However, I'm still.
Yeah. And it does take time. That's a really good point. Your body is a snapshot in time of everything you've done up until now. So when you take your posture photos today, when you start putting on your posture goggles today and you start looking at your body today, it's going to be different than next week and the week after and the week after, right? And then if you start introducing postural exercises to now train a new habit, a new posture into the body, it takes time. Like, people always ask the question, well, how long is it going to take me to get well? Well, it depends. It depends on how long it's been there, how chronic it is, and what your lifestyle is. It took me several sessions before the lady said, her rotation was so strong. And then she finally told me, well, I sit like this and read every night. I said, okay, well, let's turn your book straight in front of you and start reading this way, so that every week when you come in, you're not turning this way every time in the photos, right? So you've got to really start thinking about your lifestyle. And that's something that we help people do, is we're outside of the forest looking in at the trees, meaning your body, because we're not in it, right? you're in it. And sometimes when you're in it so much, you're not really aware of like the habits and the things that you're doing in your daily life to create the posture imbalances you're experiencing, the limitations you're experiencing. So that's where it's helpful to have, someone looking in and then bringing holistically in exercises and movement patterns. And, we teach you how to sit in your chair, how to walk, how to shoes. I mean, we cover all kinds of ergonomics and all kinds of specific things during the sessions to help, change your lifestyle to meet your posture needs and your demand levels. But, what we're really looking at is, the body being balanced from the front view. We want level shoulders and the head in the middle of the shoulders above the spine, with your hips and knees straight ahead and pointing, straight and aligned with each other, right? The more right angles and straight lines that you can create in your body, the more functional you are. And so that's why Egoscue is so effective, is because the exercises are based around right angles and straight lines. We train the body to work on the grid, basically, straight lines and 90-degree angles, so that it can activate the proper muscles to support the body the way it was designed. That's why it's so effective, yet it's so simple and it seems so easy, right? These exercises, people always ask me all the time, who made this stuff up? And I'm like, well, Pete did for sure. And, but then again, they're so simple, and yet they're so challenging, because when you're very out of alignment and you don't look like this man here in the photo, where you have a nice S curve and everything's on a straight line, ear, shoulder, hip, knee, ankle, elbow, and wrist. When you're not in that position, a basic exercise like static back, or sitting in a chair, or, putting on your shoes, trying to get that foot up to put that shoe or sock on, can be very challenging, because the bones aren't in alignment enough to actually, efficiently do that movement that the body is designed to do. So, what we're really going for is to get the most optimal alignment, to get the most optimal function out of the body. One body at a time.
Nice.
And it's such an individual journey and process. I love the process of Egoscue. It's so beautiful with every single person, and every single person learns at exactly the pace and the rate that they're supposed to, and they get out of it exactly what they're supposed to every time. Never fails. So let's start putting on our posture goggles, because Stacy, you were really good. You kind of have a really good idea of what's going on in your body. So let's see if we can't get other people to start putting on their posture goggles and see what they see.
So this is an example client. So based on these last couple slides, why don't we kind of pick apart this posture and tell me, anybody can chime in here, unmute yourself or type something in the chat. What do you see that looks off based on, the ideal posture?
Well, his spine is scoliated, or if that's the word, to his left at the thorax, and then back down to center at the bottom.
Yeah, so he's a little off. He's off center here, right?
Yeah, quite. Well, of course, he's at the top. It's not even, you see his head, the line doesn't go at the center of his head. So his head's really off to his left. His whole upper body's off to his left.
Yeah, exactly. It's not just his spine. You can see at his knees, because we put the reference point is at the bottom, right, between his ankles. So even by the time we get to his knees, you see they're shifted over to the left. And so he's like putting his weight on his left leg, basically. So someone said he's tilted and leaning forward. Yep, definitely forward. His head barely touching that line. Remember, his ear should be on the line, not the back of his head. So everything is forward. One hip higher than the other. Jen says, yep, looks like the right side is a little higher than his left.
Got some good posture people here. Are you sure you guys aren't therapists?
What else do we see? This is something, I don't think we mentioned this. Shoulders forward, yep. So you can see the shoulder is ahead of that line. Another easy way to look at the shoulders is from the front. Just look at the hands and see, first of all, are they level? Like, meaning the fingers hanging down at the same same point, or is one up higher than the other? That could be because the shoulder is elevated. But also, you shouldn't really see the backs of the hands at all from the front view, or the knuckles. You should only see that thumb and first finger, because the palms are facing in. So you can see on him, on this side, we can see probably like 2 of his knuckles over here, maybe 3 of his knuckles on the left. So that's because the shoulders are rounded, or they rotate inward and come forward. And that's what exposes the backside of the hand. So
yeah.
Let's see.
He's got a lot going on.
Nick
Definitely.
Heading forward. Yep. So in this, anybody take a guess where his pain was? It's kind of a trick question.
It might be the name of the workshop.
Well, it could be, his pain could be anywhere, right? Because it's all connected, right? So I think he had back pain specifically, and some other minor issues, but this just shows how you have to take a step back and look, because every joint in his body is affected by his posture, right? You could argue he could have pain in his neck all the way down to his ankles, anywhere in between. Yeah, so all the joints are affected whenever you change that alignment. So that's why the exercises are specific to the posture, not the symptom. So when you ask questions like, well, what's the best exercise for this kind of pain or this kind of pain? It's like, well, it just depends on your posture. That's what it comes down to. We have to change that posture, So, all right, well, here's same guy a couple months later, and obviously looking a lot better, straighter. But what specifically? So what do we notice now? What's different?
His head's in the middle.
Yeah, he's no longer leaning off to that left side, right? It's really centered, balanced, right to left. What else?
The line goes right over his ear.
Yeah.
On the right side.
I remember here. So same starting point, front edge of the ankle. But now his whole body is balanced front to back and right to left. Yeah. Head is in alignment. Yep. So you can just looking at him, he looks healthier, younger. It looks like he, maybe even lost some weight, but I don't think he did. It's just when you're standing up straight, everything just looks better, and he of course feels better too. That's the main thing. So, and it's because he did the work, right? So that's really what Egoscue is about. There's no, well, I wouldn't say there's no quick fix, because it can actually change really quickly as you'll feel doing some exercises. But it takes consistency and doing the exercises, every day, and that's ultimately what changes the body. So,
in society, we're so prone to the quick fix. There's a quick fix for everything: a pill, a surgery, an ointment, a this or a that, and a lot of people don't want to take the time to really listen to their body and honor where it's at and give it what it needs every day. And Egoscue Method is that. It's a way to begin to have that dialogue and that conversation with your body about what it needs. And, doing the exercises, you get feedback from your body. And that's what, drives the process of getting well and healing yourself. You're going to do the work, not me, not Zach. We're your guides, we're your teachers. We have the exercises. That's the only difference between you and me, is that we know 500 exercises and we know how to apply them to a body. And I could look at all of these pictures right here, right now, and write a set of exercises for that person and send it to them. But it wouldn't be the right ones for them, because I have no clue what they did for their life, right? I don't know what their works was like, what they did for fun. Did they play tennis? Was it a one-sided sport? Did they sit all day? Like, those are key factors, key pieces of information that lend us to writing a very personalized and specific set of exercises for the individual's body and imbalances. And I think that's, the big difference between us and yoga, or us and PT, that kind of thing. as that we're really working with the individual and their specific situation. Not, okay, well, this person has posture that looks like this person, and so they should have the same exercises or something like that. And we don't have a one size fits all. That doesn't work.
Yeah. So just wanted to show a couple other examples here. These are some clients who specifically had hip issues, and this client on the left here, actually, she was in that category. I've told, well, actually, I think she wasn't a good candidate for hip replacement. She was one of those situations where they didn't really know why she was in so much pain. Like, it seemed like a degenerative hip, like she had the same symptoms, but all the images looked okay. She had maybe a slight tear in a labrum, but didn't seem like surgery was going to help. So she was really desperate because surgeons didn't even want to help her. And so luckily she found us, and by correcting her posture, she's doing 100% better, which is really great. And similar story for this lady. She's really active, hikes and likes to photograph nature. And so her pain was starting to keep her from doing that. And, it's crazy how much younger she looks, right? Just by changing that. And it just shows how it doesn't matter your age. You can always make changes to your body for the better, and you're going to respond accordingly. And you don't have to suffer regardless of your situation. So another little example from our friends in Japan at the clinic there. This I like to show just kind of an extreme example, but it just shows how it can change even these extreme poor postures. We don't see that too often, but it's possible to change any posture.
But we've all seen that. We've all walked down the street and saw that person looking straight down, And that woman in particular, she worked in the rice fields. So she was bent over all day. So she is absolutely 100% a product of her environment and her activity levels and the things that she did every day. Her posture lends to that. And everybody on this call is absolutely no different. And the beauty about Egoscue is that if you have muscles, there's hope, and you can make changes because your muscles tell the bones what to do. So if your brain's telling the muscles by doing exercises, hey, we're going to get into alignment and we're going to get a new posture, guess what? The bones have to do what the muscles tell them to do. So there's really, no way that the body can't get better if you're doing the work and you're staying consistent.
Janet, you got a question?
Well, I just wanted to comment that that's pretty amazing because I lived in Asia for about 3 years in Korea, and I was amazed at the elderly women, mostly the women. And, people used to say, well, it's the diet or it's this or that or, blah, blah, genetic. But, it's obviously the work.
Mm-hmm. Yeah.
And that you can correct it is pretty amazing. I've never seen that.
Well, and we have to take it one step further too to think about, okay, what about her digestive system? What about her circulatory system, her respiratory system? Is she at a greater risk of a heart attack in the top picture? Can she even have, a really good bowel movement? Is her digestive tract all stopped up and stuck? And, does she have stomach pain? Does she have a hard time breathing? Is she short of breath? She can barely walk 10, 20 feet. All the systems are affected when the posture is out of alignment. So there might be other symptoms that you have that you haven't even tapped into yet, or maybe you're aware of them. You're not quite sure why they are there. But once you get a clear picture of what your personal posture pictures look like, lots of lights go off, lots of questions get answered. And most people have the hugest aha of, wow, that is exactly why my posture is related to my pain and why I have these limitations. A lot of times people have questions that haven't been answered in decades from lots of experts. But when they take their posture photos and they look at it, the answer is right there in front of them and they answer their own question. So that's the beauty of it, is it's so simple. Like, how could it work, right? I tell people all the time, I heard this stuff works. Every time they come in and do one session and feel better, I'm like, wow, I heard this stuff works. I don't know. What do you think? Oh, I don't have any pain. I feel totally better. Great. Awesome. Let's keep going.
We're going to do, speaking of, we can't assess everybody's postures right now, but we are going to do a little self-assessment, teach you guys something that you can do. So if we could have everyone stand up, and if you're wearing shoes, take your shoes off. Socks are okay. If you want to take them off to get a better feel, that's great, but it's kind of cold here, so I'll keep mine on. So basically, this is just a self-assessment you can do, and usually do it in the clinics with clients too, but just kind of shake it out a little bit, march in place, just stand relaxed, try not to think about it too much. Don't look at your feet, just put them wherever they feel natural for you. And then if you want to close your eyes so you can focus more, that's fine. But basically, we just want to tune in to notice what you're feeling on the bottoms of your feet. So where's the pressure specifically? Is it the same on your right and left foot? Maybe you feel heavier on one side or the other. Is it the same front to back? Or do you feel more on the heel or more on the ball of the foot? And maybe it's different on each side. You may also feel the inside edge more or the outside edge more. There's a lot of possibilities, but just get a sense of that, standing relaxed. And so anybody care to just share real quick what they're feeling? Just to get a sense. Unmute yourself or type it in the chat.
I feel mine more on the heel and then more on the right side.
Right side, okay. Anybody else?
Great.
On the heels.
Both else, okay.
I was looking at the camera and I noticed my knuckles. I'm going, holy smokes.
Yeah, you're starting
Sorry.
to assess your own posture, huh?
Yeah, I'm like, oh, rolling back.
Great. Yeah. Now walk around like that all day, rolling back, and then now you got to walk around all day like that.
Yeah, like,
Nah, that's not going to be comfortable, right?
yeah, no, I need to start wearing that Dave Asprey back brace, roll back gorilla thing
You
again.
say do this.
I need to do this. True.
So
Yeah. We'll let the exercises do the work.
with the weight distribution in your feet, when our bodies are in balance, it should feel balanced in our feet, meaning the right foot and the left foot should feel the same amount of pressure, 50-50 right to left, and front to back. So the heel and the ball of the foot, or that pad just below your toes, that should bear most of the weight, and it should be the same front to back. So if you're feeling more heels or more on your toes, then you know something's out of balance. And especially if you feel something more on your right leg versus your left, that's a sign that something in your body is asymmetrical or out of position. So it's just take note of that. You're not going to try to forcefully change that right now, but you just want to use that as a starting point. And we'll check it again in a minute. So Kelly's going to take us through a couple exercises, and then we'll check it again in a minute. So
Yeah, and then we'll check your weight and distribution in your feet again. Any exercise can be a functional test. So like I was saying earlier, if you can't put your socks and shoes on, that's something I work on with clients every week. Hey, see if we can put our shoe on, do some exercises, try it again. Is it easier? Yeah, oh great. Okay, then the exercises are working. So the first exercise I want you to try is called elbow curls. So if you can do it standing against the wall, great. If not, no worries. You can just stand in the middle of the room, and you're going to do what's called a golf grip. You're going to bend at the second knuckle, keep your thumbs out, wrists stay nice and straight, okay? Don't let them bend. Let the shoulders do the work here, okay? And you're going to put those on your temples. You have glasses, probably want to take those off. And you're going to go open, close, open, close. So the palms go open to the front, then facing each other. Try to get those elbows touching. Make sure those feet are perfectly straight, hip width and parallel. I left my feet barefoot today so you can see what a straight foot position looks like. Okay, you want that double fist between the two, between the feet, between the toes and the heel. Okay.
Yeah, so can you guys see me? It's basically your middle finger and pointer finger that are on your temples here. So I saw some people trying to put their thumbs on their heads. So the thumbs kind of point down next to your cheeks.
Just like that.
There you go.
Open and close. And if it's tight and it's hard to do, then hey, this is some feedback from your body, right? That your hinge function of the shoulder needs some work. It's out of alignment with the rest of your spine. Okay. So if you can't do these optimally, you don't feel like you've mastered them, keep doing them every day. Okay. And if they don't work standing up, try them laying on your back. That's easier. And you can accomplish getting those elbows together without so much strain. Okay. So the next exercise is called inline glutes, standing inline glutes. Because when hips get really locked up, the function of the glutes and the opening of the pelvis gets kind of stuck. So you want to take and hold on to a chair or the wall with this one. You're going to go 1 foot in front of the other, like you're on a tightrope. Again, make sure those feet are nice and straight. The space between the second and third toe and the middle of the heel are on a straight line. And you're going to hold onto the wall or the back of the chair. Make sure your pelvis and your torso are really square to the wall in front of you. And make sure your weight is equal between the front leg and the back leg. Don't be hanging out on the back leg or hanging out of the front leg. Stay right in the middle. Relax your arm and your belly. Make sure you breathe and squeeze and release your butt muscles. Squeeze and release your butt muscles. Let's do 20 times on the right with the right leg in front. Making sure everything's square and straight.
So who
Squeeze and
feels,
release your butt muscles.
does anybody feel like they can only, like you can't feel your glutes engaging, your butt muscles, or maybe one side is working but the other side's not? Anybody feel?
Yep. One side. I got a one-sider.
Yeah, okay.
Good, yep. Okay, keep trying to pull that second one in and equal the weight between the front and the back leg. It's gonna open up the hip that's in the back and it's gonna shorten the one in the front. And you're gonna notice your knees are gonna turn out a little bit. Okay, then let's take another step. Put that left foot in front of the right foot, making sure again that you're in a nice straight line. Space between the second and third toe and the middle of the heel are on a straight line. Okay, and then pelvis is square to the wall, shoulders are square to the wall, equal weight, front leg versus back leg, and then you're gonna make sure your knees are straight, locked out, squeeze and release those butt muscles. How does it feel right versus left? Is it different? Sometimes there's one side that's easier or tighter or looser, or, you know, maybe it's harder to stay straight here. Your body wants to twist and rotate. That's a sign of an imbalance. Okay, let's do about 5 more. Get to
My left side is screaming at you doing this.
Yeah, the body's talking.
Screaming. It's mad at you. It's mad at me. It's mad at you. I have a serious issue.
Yeah, well, take a little break. If the body's screaming at you during exercises, it's usually saying, hey, 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 you might be out of balance and take a break, right? So here's the next one. Let's keep those feet nice and straight, hip width again. And we're going to learn how to hang, okay? The Egoscue way. So most people have learned just to bend over and touch their toes. That's not what we're gonna do, okay? We're gonna do it with really specific posture and alignment, focus, and technique, okay? So you're gonna square up those feet, make sure they're hip width, that double fist from front to back, right? Thighs are gonna stay tight. You're gonna bend over to touch your toes, but you're gonna keep the weight centered in your feet from front to back. Don't let your butt hang back and all the weight go into your heels. Keep the weight right in the middle of the feet, thighs tight as you can get them, and just let your body hang. Let the muscles along your spine relax towards the floor. Let your head, the full weight of your head, hang to the ground.
Yeah,
Keep those thighs as tight as you can and breathe.
don't reach with your arms, just let the arms relax and hang there. If you touch
If you're
the ground,
having a hard time with your arms, grab your elbows. That way they have something to do. Okay. And then let's roll up nice and slow. Take a big deep breath. Make sure you have the chair there in case you're a little lightheaded. Come up nice and slow. Okay. Now let's kind of march in place for me. Just take a couple steps in place. And then let's stand in the middle of the room again. And I want you to feel back into the bottoms of your feet. Where's your weight distribution now? Is it the same? Is it different?
It's more balanced.
So Stacy, you were feeling more on one side of your body, right?
Yeah, but it's definitely feeling more balanced.
Yeah.
That's good.
How many people feel more balanced? Raise your hands. Or noticed a shift, a difference, right?
Yeah.
Great.
Sounds like
Great.
And these, by the way, these exercises are, we had to pick stuff that was kind of generic, right? So nothing, we don't know,
Yeah.
everybody has different postures, so everybody's going to respond differently. And some of these exercises may work great for some of you, but not for everyone. So it's okay if you can't do them all, or maybe you didn't feel something as significant as others, but this is just to hopefully give you a little taste and showing you how just doing 3 simple movements can make your body more balanced. You feel more weight just evenly distributed in your feet. You may feel hopefully a little less pain. You might feel a little taller. Anybody else feel anything change there? Got a couple hands raised. Questions, Russ?
I'd like to ask if that exercise with the feet on the tightrope, I don't remember that one from my book. Is it in the book here?
No.
I don't think so.
It's
I
one
think
of
it's
the many.
interesting. Sorry?
Yeah.
Yeah, there's
Yeah. So when Zach and I were thinking about the hip workshop, we wanted to do some of the ones out of the new book, and we took the ideas from the new pain-free book, the revised version
Okay,
that just
that's
came out,
cool.
which is fantastic.
Mhm.
And we did something similar, but not the same, because there's certain ones that are easier to do in a group like this versus not. So more
Okay.
one-on-one.
Thank you.
Can you send us these?
They are going to be in the recording, so you can go onto that recording anytime and have me talk you through them. Yeah, you
Okay.
can just fast forward to that point and watch it.
Okay, where do we find the recording? At this same Zoom address?
No, Zach is going to send out a link, tomorrow he'll send out an email that will have the recording link in it. And then I
Okay.
believe you posted on YouTube, right, Zach?
It'll just be a YouTube video. So
Okay, great. Thank you so much.
yeah, so these, once again, these exercises were meant to, they can very well help with your hip pain, but if, we've got some questions about, what if my hip hurt when I did this? And it just goes to show how, once again, we have to treat the individual. And so that's where getting, we'll talk about that next, but that's where getting, a one-on-one approach and getting assessed to figure out what your posture is doing and what, everything leading up to your current state is going on, so that we can give you the right exercises for your body. Because it's okay if these didn't feel great for you, and if they did, awesome, you're welcome to do them as much as you can, but nothing's going to replace or be as good as a specific routine, obviously, for your body.
Yeah.
So
Yeah.
okay, just 1 or 2 more slides, I think, and then we can wrap it up. I gotta share my screen, sorry.
I love seeing everybody's faces though. It's so fun.
Okay, so next steps. First thing, yeah, so maybe you're still skeptical, which is totally fine. This is brand new to you, especially. You probably have a lot of questions, and that's great. The book is the Pain-Free. There's several books that Pete wrote, but Pain-Free is going to be your best bet. You're brand new, or even if you've done this before. The new edition just came out last year, so look for the second edition. It's got, all the books have the same basic information, but this one is the most applicable, I think, to today's situations. And there's exercises in there you can try for various body parts and pain. And it talks about more in detail about the method and how it works, so I would definitely recommend that book to anybody. And you can get it for like $15 on Amazon or at your local bookstore or library even. So now some of you might be thinking, this is great, I'm familiar with this, and all sounds good. I still have some questions though, what about my hip dysplasia, or what if I've been in a car accident, or what about, I don't have hip pain, but I've got some XYZ issues, So we're happy to chat with you one-on-one and get a better idea of what's going on and help you figure out what to do next. So we're offering everybody here a free posture evaluation. So that means we'll either on Zoom, we can do it just like we're doing here. We'll look at your posture. We can take photos, help you see exactly what's going on, and then talk about how that's related to your issues. So that usually takes 20 or 30 minutes, won't cost you anything. Just to clarify, we won't be giving you exercises per se. That's just for the evaluation and just to help educate you, but that's free. Now, if you're ready to actually get started and you want to, work with someone one-on-one, you feel like Egoscue is a good fit for you and you're ready to see some of those transformations in your own body, then if you sign up in the next week, we can give you a 10% off discount just for attending our workshop today to work with us one-on-one. So what that looks like, here's the prices with the discount applied, and it's the same price at any Egoscue location, but these discounts are only good for Portland or Seattle in the next week. So first appointment typically takes an hour and a half because we're getting to know you, going through your health history and going through the assessment, and then showing you the exercises specific for you. Then you have your exercises you do every day at home on your own. And then we meet usually on a weekly basis to make sure that you're doing things correctly, and that as your body changes, we want to reevaluate and make sure that you're on the right track and adjust the exercises as needed, maybe give you more challenging ones, or maybe we have to modify the ones you're doing. Ultimately, just help guide you through that process of unwinding those old habits and creating new ones. So the sessions are typically one-on-one for an hour or more. On the first appointment, it takes longer, but they can be done in person or Zoom. So regardless of where you live, we can work with you on Zoom at least. But if you're closer to Seattle, you can reach out to me, or if you're closer to Portland, reach out to Kelly. We've got our contact information there, and we'll be, as I said, sending out a recording of this probably tomorrow. But that's about it. So what questions do you guys have for me or Kelly now? Otherwise, we'll wrap it up. Where am I located in Seattle? Northgate area. So just, I guess the mall is not technically there. I guess it's still the Northgate area, but yeah, North Seattle, right off I-5, really easy to get to. Any other questions?
That was your time. Ask away. You've got us. We're here. 20 years of experience. Let me have it. The biggest question people have is, can you help me? Is my situation can I be helped? Anybody have that question?
Sure, I have that question.
Yeah.
I got two things. I have discs in my neck that are, according to the MRI, showing not much space left, and I'm having a lot of pinching and stuff going down my arm. But then my left hip is also giving me a lot of trouble. So yeah. Can especially the neck, can that be like helped at all? I do acupuncture and she does some adjusting, kind of like the chiropractor does, and
great
massage and stuff. The last flare up I had took several months for that to settle down, and it was okay for a while and then just flared up again. So can this kind of thing help that?
Yeah, well, it's always the question, right? Which came first, the chicken or the egg? Well, it doesn't matter because they're all connected, right? So your spine is one unit and it's connected to your pelvis, like Zach showed in the slides earlier. So, you could be locally treating just the neck pain or locally treating just the hip pain, separate from each other as separate symptoms, as separate parts of the body. But the pain may not go away in either place because you're not treating and looking at the body as a unit, as a whole, right? So here's an example I always tell people, like we did earlier, touching our toes, right? People can go their whole life without touching their toes. I was in a talk one time, and a man, he was 48 and he could not touch his toes, and he had hip pain, back pain. And after one exercise, he was able to touch his toes after 48 years of never touching his toes. And he stretched every day, but he didn't change the posture. The pelvis was stuck because it was attached to the rounded forward shoulders. And when we changed the shoulder position in relation to the spine and the pelvic position, then he was able to touch his toes and gain function and get out of pain. It was miraculous. He was crying. But it was such a great testimonial to, like, the body's connected and you gotta work all parts of the body, not just treat symptoms in one part and another, because they're related, they're connected. And the body's a movement machine. It is built to move. And if it's not moving properly or in alignment, it's not functional. It can't do the things you want it to do. So does that answer your question?
Yeah, that all makes sense. I guess I'm just wondering if once your discs are, compressed and you don't have much in between them, if there's anything that actually can bring that back, or if you're just managing alignment to hopefully minimize the pain and symptoms that you have.
So you're always going to be managing your posture and your alignment because you have a body in this lifetime, right? So it's your vehicle. So just like your teeth, you're going to brush your teeth because you want to keep your teeth. You're going to need to do alignment exercises from now until the day that you die to keep your alignment, because your body's a movement machine. So the damage that you currently have is a snapshot in time of everything you've done up until now and how your posture is holding itself currently. And you don't want to go any further down the road of degeneration and you have a certain number of vertebrae that are impacted at this point. But if you keep going and you don't do nothing, it's going to impact more and more and more vertebrae, and there's going to be more and more and more symptoms, and usually more and more and more surgeries. That's usually how it goes. So at some point, pre or post surgery, it doesn't matter whether you've had surgery or not had surgery, you have to intervene and start addressing the root of the issue, which is the misalignment that is there, to prevent further issues and correct the issues that were there to begin with that caused the symptoms and the degeneration and the chronic issues you have currently.
Yeah.
Okay, thanks.
Does that help?
Yeah, it does. Thanks.
Oh, so glad. Okay. If you have any more questions, please let us know.
I will say, like, we've worked, I have, and I'm sure Kelly has worked with many people with those same diagnoses, like compressed discs, stenosis, bulging discs in the
all the time, every week. It's the number one on my schedule.
Yeah. So, and to varying degrees of success, but I would say in general, most people do have pain relief, by doing Egoscue. So I just worked with a lady this morning who told me she's been working with me for several months now, but she said this past 2 months she's had no neck pain, and she's in her 60s, 70s actually now, stenosis. Like, if you were to look at her x-rays or MRIs in her neck, it's not pretty. Like, she's got it all, and yet she has no neck pain. So it's like,
yeah,
I think it's definitely possible, even if you do have some severe stuff happening there. Like, it's pretty amazing what the body can do. So
there's a lot of people walking around with stenosis that have zero pain. And it's actually really common as people age to have herniations, slight herniations and stenosis at a certain level. It's just whether your posture is off just that enough, and or that your lifestyle, that things that you're doing in your life are creating enough of a push-pull that you're in pain versus the people who aren't. And so the goal isn't to get your posture perfect. I've never met anyone who has posture that's perfect, but the goal is to get like that guy. He was so asymmetrical. Once he got more symmetrical total body, even though his legs were still rounded, he still had what we call kind of bow-legged position. But to have two legs that are bow-legged and the positions more equal and balanced right to left, that's way more functional than being really out of alignment in all planes of movement. That's challenging for the brain, it's challenging for the body, and it's painful.
Terry, do you want to elaborate? You had a question about nerve pain or the hips?
There we go. So back when you were showing the anatomy of the hips and stuff, and I was just curious, where is the pain coming from? Where are the nerve endings? And I guess it was just a curiosity, when someone has a hip replacement, do those same nerves still work, or have they cut those, or and for me specifically, I've never had chronic hip pain, but I recently started taking statin drugs, and I had read that joint pain could be a side effect of that, and a common side effect. And so, and just a couple of weeks ago, I've been walking a lot lately, and just a couple of weeks ago, both of my hips just really hurt. And this morning when I walked, it was just the left hip, and it's just, it seems to be deep in the socket. So I don't know, whatever you want to address of that would be great, but otherwise I'll talk to you, Zach, when I see you. So.
Yeah, I mean, I think in general, when they replace the hip, like someone else was talking about nowadays, like it's actually pretty, I mean, they don't damage more than
Really
they
efficient.
have to. Yeah, like, so they're not going to cut any nerves. They're not going to even necessarily cut any muscles. They might move them around a little bit, but yeah, so that's not necessarily an issue. I think we also have to kind of, once again, think about pain a little differently, and that it's not, we can't blame like one specific nerve or one specific muscle or one specific little tear we see in a joint on our pain, because it just, we have to think globally again, right? So what's the real cause here? Because like Kelly was talking about, stuff like stenosis, bulging discs happen all the time in people, and they never know it because they don't have symptoms. So we tend to have a symptom, and then we think, oh, let's go find the damage that's causing the symptom. Well, chances are you're going to find something. It doesn't necessarily mean that's what's causing your pain, though. You could go down that rabbit hole and with imaging and stuff and find all kinds of scary looking things on your x-rays, but and yet not have any pain. So sometimes I don't know if I'm making sense here, but another example is I work with a lady who's had her below the knee amputation. So she doesn't have from her knee down, was cut off 20 years ago, and she has a prosthetic. And yet sometimes she still feels pain in her foot, which doesn't exist. So how do you explain that, right? So, pain is a tricky thing, and the brain is really interesting. So that's a whole nother topic. But even if the body part doesn't have damage, or even if the body part's not there, it doesn't mean that you can't have pain there, or vice versa. So that's my 2 cents.
Well, does that answer the question? Or do you still feel like there's a missing piece?
No, that gave me some more information, but.
Good, yeah. I'm always all about people getting all the information they need to know about their body to be the expert in their body, their condition, their situation. I can't tell you how many people go get treatments, surgeries, take drugs, do all kinds of things before they even know anything about what's really going on. And that's really disempowering. We want you to be fully, educated on, well, what is going on? What does my MRI say? What is my x-rays? Be fully informed with all the information that you have about yourself and your situation. It's all information. Good to know. And checks boxes. It gives you peace of mind. Peace of mind is the most important thing, right? And then from there, you can create a plan.
I have a question.
Go for it, Stacey.
Okay, I didn't know if I was on mute. So
no, I just can't see your face. It's just on your torso.
You know what? I can lower myself.
Okay. You don't have to sit. Yeah, I just had to see your name. I couldn't see your name.
That's fine. So with the body and how it all moves together, Can a frozen shoulder inhibit some of the healing for the hips? Because you're not getting that movement going?
Yep. Yeah. If I look at a posture in a body and I see that, you know, they have had a chronic posture imbalance that hasn't been addressed, there's absolutely no way that the pain in the knee on the other side of the body is going to get any better until that shoulder on the other side is in better alignment. It can't happen because your arms are cross balances for your legs. And if the alignment's off and your right and your left side of your body can't swing, you know, at opposite times, then your complete rhythm is off. Yeah.
So it could keep someone from getting well until the frozen goes away.
That's right. Yep. Until you get full range of motion of that shoulder. Remember, it's connected to the spine, which is directly connected to the pelvis. The pelvis, either on the opposite side or right below, is going to be locked up and compromised as a result of the dysfunction of the shoulder.
Okay, so one more question. Regular doctors say, you know, this is just going to be a process. It's going to take this many months/years. Can you guys unfreeze the shoulder faster, or is it still a little bit of both of time and
yeah, frozen shoulders, depending on how long you've had it and then what the rest of your posture looks like. So remember that frozen shoulder can't unlock itself until the other stuff in your posture is addressed. But you can't treat them separately. They're not separate. Yeah. And the hardest thing for people is the patience game. Okay. Like, how long is it going to take, right? If I could answer that question, I would be super rich and I'd be God. So therefore I am neither. But what I can say is that you want to let your body unfold in the process that it wants it to. You don't want to force it, push it, crack it, snap it, you know, like force it, because you can actually cause damage, right? So at Egoscue, it's very gentle. You've done the exercises out of the book, some of them. So there is a fair amount of like time on task. Yes, you have to wait for your body to unfold, but there's also lots of tips and tricks and techniques that we can use to help speed it up and get you quicker results and faster progress. Absolutely. Mm-hmm. And that comes from knowing, well, what's really going on, you know, and having kind of that other person there to see all the things that you're missing, even though you're in your body. We're able to tune into things that have 20 years of looking at people's bodies that you may not have thought of or yet, you know what I mean? But then once you get it, you're like, oh my gosh, I knew that, but I didn't know how that piece fit in. And I didn't know the education around it that could make the difference in going forward.
Okay. Thank you.
Hopefully that helps.
Oh, very much so.
Any other questions, anybody?
Yeah, some really good questions. Thanks for the.
Yeah, awesome questions. I love it.
And if you want to talk more with us one-on-one, I'll go back to you can look on our website or.
Yeah, reach out. We are here to help. Email us, call us. We are here to help. Please don't be on the island all by yourself, waving the flag, you know. There's a solution for everything. And my motto is suffering is optional. Once you know what's going on, you can come up with a plan and get moving.
All right. Well, thanks everyone for joining us, and I'll send an email tomorrow with this recording and just a reminder on what the next steps can be for you. But thanks again, and hope everyone has a good rest of their evening.
Thank you.
Take care, everybody. Signing off from Portland.
Thank you.
David.
Thank you.
Thank you for being here with us.
Thank you.